Wear the Gown is sponsored by CHI St. Vincent.
Today is February the 1st. It's the start of National Health Month, Heart Month, I should say, a time when we should all make sure we're heart healthy. It's especially important right here in Arkansas, and Craig O'Neill explains why.
As tragic as COVID-19 has been, almost twice as many Arkansans will die from heart disease. And in a lot of ways, COVID has made heart problems even worse. Here's interventional cardiologist Dr. Nazneen Tata.
We've seen a lot of people sit on symptoms and basically hope for the best because they're afraid to come into the hospital or clinics because they're trying to be safe. And I tell people, we'll keep you safe. You just need to come on in and get that help before it's too late.
And if there was one overriding factor at the root of heart disease,
it's hard to put a finger just on one. What I would say is lifestyle.
Of course, she means diet, exercise, no smoking.
There is no good number of cigarettes. 0 is your number. But when I talk about lifestyle too, it's also stress. In the world we live in, psychological stress is just as important as physical stress.
Dr. Tata is quick to point out this stress is not just in men. Women need to be aware too.
When you're under stress, there's a lot of changes in our neurohormones, and that puts strain on our heart physiologically. So women need to understand that.
Heart attack signs in men are very familiar. Pain in the arm, shortness of breath, chest pain.
But with women, what we see sometimes, it's more of an indigestion type feeling, so like a heartburn feeling.
Outcomes for women are improving, but in terms of year-to-year outcomes, women still do worse than men.
We're good at nagging, but we got to take our own medicine sometimes.
Bottom line, don't let ignorance become an underlying condition. Know your heart health.
I cannot tell you I'm going to buy you 50 more years or 20 more years. All I'm trying to give you back is quality of life where you can enjoy the time you have to your best abilities. And I think once people recognize that, I have seen people turn around their lives.